Hi there. Today I want to talk a little bit about shoulder pain and how, at MTP at least, we treat pain without treating pain. And what I mean by that is we really want to emphasize function. Now, a bit of a trap that we can get into with shoulder pain especially is chasing after a painful spot, chasing after a diagnosis, when what's actually required to get you back to where you want to be, to get you feeling better, moving better, and doing the things you like doing, is actually improving your function of your shoulder. And rather than chasing down the rabbit hole of where's the sore spot, which structure specifically is involved, what is the exact diagnosis of which structure is involved, we focus on what are the factors that are most likely pushing unnecessary stress towards the shoulder that's causing it to be uncomfortable, it's causing it to be irritated and sore when you do things. Now, just to delineate, first off, we want to make sure, is this something that we would deem as structural? Is it something that is torn, damaged, broken, you've fallen, you've twisted, you had a traumatic incident? Or is this something that's sort of just bubbled up over time? And now typically when there are bubble up over time problem, well, there's not a specific reason for the onset of this issue, we call it a functional problem. If it's something that you've fallen on your arm, you felt a pop, you've had an incident that you can pinpoint down, then there's likely a structural problem underlying, and you need to address the pain. You need to mitigate the pain, you go through the physio process, manage the irritation and the swelling, manage the recovery process, and then start to look to building back your function again. That, although it's traumatic and is uncomfortable, is often not what people present with. More often than not, something has just brewed up over time. It's something that you didn't do a thing to cause. It's just suddenly sort of reached this threshold. Maybe you shook it off a few times. Maybe you felt something annoying in the background when you were doing particular activities, but you didn't think much of it. And then suddenly it's become irritated or annoyingly painful when you do lots of things. Now, just treating the pain, which is this alarm bell going, geez, you're really irritating me, you're spending too much time putting stress on me, can you please stop that? And you're trying to treat that pain by pushing, poking and stretching and rubbing, isn't necessarily going to make the pain go away. It might make it feel better in the moment, but then what happens is you go away, after you feel a bit better, you go and do something, you do it how you've always done it, and then it gets sore again. And you go around and around a merry-go-round until eventually people go, oh, I'm so fed up with this, I'm going to get a scan, I'm going to see a surgeon, something needs to be fixed. And it's not always the case. Most of the time, how you're doing things is a bigger problem than what is going on in the joint itself. Now, when we talk about the shoulder, this is particularly important because the shoulder is what we call a floating complex. The only point on the shoulder that's joined to the rest of your skeleton is at the medial portion here of your collarbone that attaches to your sternum. The rest of it is just floating around on your body. And what holds it stable, what allows you to use your arm to pull and push and lift and do pull-ups and push, pick up your kids and swing on playgrounds and all the things that you do in your life, is this muscular strength and the control that you have of the shoulder blade and the glenohumeral joint or your upper arm. Now, if you don't have control that matches the demands of what you want to be able to do in your day, then there's lots of stress that you're not taking care of. And where does that stress go when you're not taking care of it with the muscles? It goes to the joints, it goes to these soft tissue structures, the ligaments, the labrum, the tendons and so on, right? So that's when we start to get angry shoulder joints, pinching structures, supraspinatus or rotator cuff, tears or irritations, bursitis, all of these common problems that people present with pain for, and then they want to get the pain treated, and then they want to do something to stop the pain coming back. But what they're not looking at is more broadly, what is actually causing the stress to be pushed into those structures all the time? And most of the time, it's not enough control of your shoulder blade and your upper arm. Now, when we talk about the shoulder blade, we need to think about the structures that are underneath. So serratus anterior, which wraps around onto your ribs and acts almost like a suction cup to kind of pin the shoulder blade down. When it's weak, you get a lifting off of the shoulder blade called a winging scapula. It's not something to be worried about necessarily, as long as you just need to do the work to strengthen that muscle up. Serratus anterior, the rotator cuff muscles are really important. We also want to focus on your biceps, which run through the front here, the triceps, which are through the back, your lats, which wrap up and across, there's up and under. There's lots and lots of musculatures that need to be considered in when you're looking at the shoulder girdle, the pec muscles on top. So it's not just a matter of doing basic, simple push-pull, rotator cuff movements. We want to look at big muscular control as well as those smaller mechanisms deep, like the rotator cuff and serratus anterior. So when you present to MTP, what's going to happen is we'll talk to you about your pain, but then we're going to look at your function. We want to look at how well you stabilize your shoulder blade, how well you stabilize your upper arm, how well you dissociate the two. Like, can you control your shoulder blade and move your upper arm without moving your shoulder blade? Can you move your shoulder blade without moving your upper arm? Can you do a bending and extending movement with your elbow without your whole shoulder moving around when you do it? These are really important factors that need to be looked at when you're dealing with a shoulder pain presentation. The other things to consider more broadly is how much movement do you have in your upper back? Do you have enough stability in your neck, in your upper back, in your pelvis or your lumbar spine? Can you control those positions through your spine while you're using your upper arm? Or does everything sort of move around simultaneously? Because if everything's moving around while you're trying to control your upper arm, you're going to cause yourself a lot more challenge to deal with, which is going to cause a lot more banging around and instability and subsequent irritation and discomfort. So when we look at shoulder function or shoulder pain, we can't deal with the pain without addressing the function. You can't deal with the function without looking more broadly at how you control the shoulder blade, the glenohumeral joint, your pelvis, your lumbar spine, your thoracic spine, your cervical spine. Like, how do you control those movements? Do you do it well enough so that your shoulder isn't the worker bee doing too much all the time to make up for other problems, which is why it's in pain. So we're not going to just be on the table and push on your shoulder and make it feel better. We want to look at what's actually causing this so that you can enjoy your movement, enjoy your function. Just a quick reminder that we still have all of our online programs available for 30 days free. You can jump in and try as much as you like for 30 days. Look through all of our content. Make your mind up whether you like it or you don't. That's perfectly fine. We want to hear from you either way, but you can access it all for 30 days at no charge. Jump in to mtponline.com.au. There's shoulder programs, hip programs, knee programs, healthy at home programs, mobility programs. There's a ton of content there. Video guidance of every exercise and educational material, downloadables, you name it. It's all in there for you, free for 30 days. If you choose to continue afterwards, it's just $29.95 a month, less than a coffee a day, to just access a whole range of materials that will keep you moving well, feeling great, and living your best life for the long run. So check it out, 30 days free, mtponline.com.au. Can't wait to see you there.